That's very kind of you. I'm Al, and please call me Al, as Paul Simon says in his song. So I'm really pleased to be here this evening. And I want to preface what I want to say by a question to you guys. How many here think that all is well for children and childhood in England today? Right. None of you think all is well. That's really very important. So immediately there are three following questions. The first is, what are the facts? The second is why? And the third, most important, is what do we do about it? Now, in my preface, when I introduced myself before, I told you I'd worked for 46 years with and for children, as the first Children's Commissioner for England, President of the BMA, etc., etc. And I stand before you today outraged, absolutely outraged by what is happening before our very eyes to children and childhood today in England. For many, it's the best of times, and that applies to children in our own families, I'm sure. We are affluent, we're middle class, we're articulate, we can kick the doors down for what we need. But for far too many, it's the worst of times for children, because you may not fully understand that we have the worst, not the middle ground, the worst outcomes for children's health, education, social care, youth justice and poverty in the developed world. Now, in the last week alone, I have met with over 800 people in Newcastle, Wolverhampton, Walsall, and yesterday in Nottingham, talking about the early years. Now, many of you may have children or grandchildren who are of a nursery age. What are your views about what it's like, A, to get your children into a nursery, B, to have confidence they are being managed by people who understand children and child development, and C, are able to declare their outcomes. So why do we have this dismal situation in England? Well, the facts are available in a wonderful book that was published in October. I know it's wonderful because I wrote it. And here it is, with a gentle title, The British Betrayal of Childhood. And it is an authoritative, evidence-based analysis of where we have come from in our history of childhood in this country, where we are now, spelling out the facts that justify my conclusions, and above all, with recommendations for the future. We have to give hope to families. Look, 200,000 more children have gone into poverty in the so-called Northern Powerhouse in the last 5 years. We have to give hope that somebody actually cares about their predicament and that something is being done. So I offer you a strapline because, as well as the dismal side of things, I do know there are some very good things being done. For example, we are creating networks of the willing in Cornwall, in Nottingham, in the northeast and the northwest. And last week in Newcastle, the third of three major events bringing together 450 great and good in the north who agreed to sign up to a program to put children at the heart of local communities. And Cornwall, Michael has been hugely influential with the Duchy Health Charity, replicating its amazing program of actually having integrated health and emotional support in schools. Cornwall has just appointed 30 assistant psychologists to work in every one of its secondary schools. So there is evidence of things being done well, but we need to brigade and package this. So I'll offer you a strapline for your consideration. The strapline is celebrating new ways of working to improve the lives of children and young people today, it really doesn't have to be like it is now. And I've road tested this strapline in the last week in the places I've been to and elsewhere. I've discussed it with Michael, And there is support for this, to the extent that yesterday I had confirmed that Nottingham Trent University, which, by the way, is one of the most nimble universities I know, it's not part of the select clique of the Russell Group that are buried in the Stone Age. Nottingham Trent University is seriously nimble. It has created the Nottingham Centre for Children, Young People and Families, which is motoring fast. And in the autumn of last year, we had the first international conference there on adverse childhood experiences. And we brought in experts from Canada, from Australia, from the US and the UK. Very, very successful. So I have an agreement from Nottingham Trent University that in the summertime of next year, we have a second international conference with the strapline I've just given you, celebrating new ways of improving the lives of children, etc. So I find this really very, very encouraging. So what does this mean for the College of Medicine? Well, Michael and I were invited to Dumfries House to meet Prince Charles and the Dumfries House Foundation recently, because in Scotland they're very, very concerned about self-harm and indeed suicide in young people. And on the way back in the captive environment of a cab, I sat beside Michael and we tossed around some of these ideas. And the purpose of being here tonight is to suggest that this strapline, the background, the work I'm talking about, could be very, very useful and indeed influential in the College of Medicine. And I'm keen, first of all, to make sure that we are advocates for the best interests of children. I offer 4 reasons why we have such appalling outcomes. The first is our public and political attitude to the importance of children. We go on holiday in Spain, Portugal, Italy. What do we see in the evenings? We see families. We see children being welcome in society. Little Heidi, I report in my book, little Heidi, 60 months old, was asked to leave the John Lewis restaurant in Trafford because she was crying. That's the level of the intolerance we have to our babies and children in this country. So, being advocates, what can we do? What can we do to raise the profile of children? I know people get a little bit irritated that wherever I go I say, and what does this mean for children? Because so many of the problems adult services are working with, rheumatoid arthritis, whatever it may be, have their antecedents in childhood. Yet trying to get traction with the adult service is very, very difficult indeed. So perhaps the college might be a source of advocacy, and I'm delighted that Doug has this stream in the food conference, because he's bringing over from Finland people who in a town in Finland have halved the obesity rate in children over the last 10 years. Now that needs to be listened to. It needs to be promoted through an effective media campaign, Mike. So first of all, advocacy. Then secondly, perhaps some events that could be badged or co-badged with others. I offer you Nottingham Trent immediately. Would the College of Medicine like to be co-badged with this international event we're planning next year? And then we've already road tested having some huddles. I'm a great believer in huddles, bringing 1 or 2 folks together to talk over a sandwich. And we are having huddles to look at the methods to understand the lives of children. And we are linking with Vancouver. We had one of our staff went to Vancouver last month, and one of their staff came to Newcastle last month to talk about the metrics of how we measure developments. And the third thing the College of Medicine might be interested in doing is defining a strategy for children and young people. And Michael has asked me to be the lead for the College of Medicine, and I'm delighted to do so, but of course I can't do it by myself. And so I'm looking for an expression of interest or disinterest. If you feel like telling me to rush back to Planet Zog, I'm happy to do that, but can I hope to persuade you that it's in our hands to improve the lives of children today. They matter to you and your families just as much as they matter to me. Why then, as a society, are we in a state of such denial over their importance and such dismissing of the hard facts about how awful the lives of so many children are?